Good morning, everybody. How are you today, this lovely Thursday morning? I hope you're up and you have a routine and a schedule and you've planned your day, even though most of you are staying at home, unless you're obviously a key worker and then you have to go to work like us, which is okay, which is fine. We tackle what we have to tackle and we keep going. This is day 18 of the Vine Health COVID-19 live updates, which we host here on Facebook. But again, we share it on every other social media platform. So please, if you're on Instagram, you can watch it there, or on YouTube as well. That would be great. So I've titled today Resilience. So resilience is the ability to bounce back after setback. So we're still in the sort of not the very beginning, but we're going towards the peak of the pandemic, and it's getting quite tough for many people. So this is a time where we need to draw on that resilience and that ability to stay strong despite how everything is looking around us. So this resilience we're going to be talking about today. I'm also going to answer questions that have been posed in the last 24 hours and just give you an update of what's happened again in the last 24 hours. So the purpose of this is to bring you facts, not fiction, and to bring some hope and just keep us strong during this time. So, I'm feeling fairly relaxed this morning. Just really sort of took my time yesterday to really rest after work. But looking at the updates from yesterday, again, the news is not great. The news is not great, but this is what is going on. And we just have to be strong and be bold and just hang in there. So the cases of coronavirus infections now has gone up to about 1 million globally. So about 1 million globally. And the deaths are about almost 50,000 now globally. If we talk about this, I'll start with the United Kingdom today. With the United Kingdom, when I spoke to you yesterday, I said, oh, well, the death rates jumped a little bit, and then it's jumped even more. But bearing in mind that people in the community who are dying from coronavirus infection are also being counted. So the number of deaths in the UK has gone up to almost 2,500, the jump of about 563 in 24 hours up until yesterday. So we don't know what today will bring, but we're hoping that this peaks and starts to flatten at some point. And that's why you're staying at home. So please continue to stay home. They said that the traffic increased yesterday. So it may be that some people are getting really fed up of staying at home and are going out, but please let's just hang in there and let's stay indoors. The other thing about the United Kingdom is that the testing, what we're saying is that we have to keep testing people so that we know who has it, who has had it, so that we can make the appropriate, take the appropriate steps. Unfortunately, in the United Kingdom, I think we're testing now up to about 12,000 tests a day. Compare that to Germany, who are doing about 70,000 tests a day. And that reflects in the death rates. So it's much lower in Germany than it is in the UK. So the government has promised to increase this testing as quickly as possible. And it also has an impact on healthcare staff. So many people are staying at home who can be at work, but they're staying at home because they are isolating, or somebody in their house has had this. But if you have been tested and you've had it, then you know that you've had it and you can go to work. So we're charging the government to increase the testing as much as they can, so that people can just sort of carry on with their lives, and people that have it can stay home. The more we test, the quicker we can get out there and go back to normal or near normal. I don't think we'll ever be normal now, at least for a year or more, but at least we can go back to a semblance of normal. Well, the United States, we know, again, cases in the United States have gone up to over 200,000. Cases in the UK are about 29, almost 30,000. In the United States is almost over 200,000. And the death has gone up to over 5,000. Most of that is in New York. So again, our hearts go out to New York, and hopefully they will carry on doing what they have to do, get the lockdown in place, and just keep going. With Nigeria, again, I had a little moan yesterday. I'm one person, I always feel like if you don't have anything positive to say, don't say anything at all. I really don't like judging. I don't like telling people what they're doing wrong. I think most people know what they're doing wrong, and particularly when it comes to Nigeria, I try not to be too negative about it. But as I'm going to have a positive spin before I say the areas for development, as we say in our GP educator world. So not a negative or areas for development. So the cases have gone up to about 174. Again, that might be reflecting the number of tests that are being done. There are not many, but I must give kudos to the NCDC and the work they are doing. They are trying to set a standard, and I can see that. I can see that on their social media platforms and the way they come across. That the NCDC, Nigerian Center for Disease Control, is doing its best to come across as a very professional organization that is excellent, and we support them and we salute them for that. However, on the wider scale, there's a whole lot more to be done. So all those videos that we're seeing of people protesting, of the army and the police beating people up, not acceptable. There's no need to humiliate people. There's no need to treat Nigerians like they're animals. We're not animals. Let's start to honor ourselves and try to respect ourselves. Because if we don't respect ourselves, who's going to respect us? Many of us are, living in the West, and we are demanding respect from work, from our workplaces, from our neighbors, from people around us. But our government needs to value us. You can't just go around smacking people and whipping them because they haven't, stayed at home. Or, there are other ways to do this. In the West, people are also being disciplined, but they're being disciplined in humane ways. You stop them, you give them a fine or something, or arrest them, but do it with dignity. So yeah, Nigeria is in lockdown as well. So, and that's for 2 weeks. So we're keeping our eye out for what's going to happen. I'm really looking at what's going to happen there. Okay, so I hope you're all staying safe. So I'm going to answer some questions that were posted to me from yesterday, which I'll try my best to answer. There were a few hand sanitizer questions. I wasn't expecting that, but I've got that. And also there was something about why are diabetics considered to be at higher risk if they get the disease. Anyone who has a chronic disease that particularly requires things like the flu jab will be at higher risk if they get any infection. And then add the added complication of a high blood sugar. So if you get an infection, then there's more likelihood of more complications. The sugars go up, and you can have problems with very high sugars, can have problems with infections as well. So there's a list. I put that list on the video from yesterday of people who are vulnerable, and the guide from the UK government. So if you go on yesterday, day 17's comment box on Vine Health page, you'll be able to find that link there. So question was, let me just read that out. Someone said here, I hardly go out except to the market once in a while, and once I'm back, I take a bath, not minding that I went in a private car. I'm only concerned about washing my hands when I'm cooking. Is that okay? Yes, if you go out, you don't necessarily have to come in and have a bath unless you've been with a group of people, which you shouldn't be with anyway, or you feel like you've touched things. So I guess as an extra precaution, you're having a whole body bath, which is fine. But I think going out, coming back home and washing your hands with soap and water will protect you equally. Obviously, if you have been with, a key worker, or you've been in a hospital, or you have been treating COVID-19 patients, it depends on your risk, so you have to wait. But if you're going in your private car, going to one place, not interacting with anyone, hardly touching anything, and if you come back, then you wash your hands with soap and water for the 20 seconds, making sure you get every part of your hand, and that should be okay. So that's that question. If you have other views, please let me know, but that would be my view on that. And I also say that she says here that I only wash my hands when I'm cooking. I always say to my children and to everyone, even when you're at home, just make it a habit to wash your hands, intermittently during the day. So, and the easiest way to remember that is to wash your hand before every meal. So before you have to eat something, wash your hands. And that would be a good reminder rather than setting an alarm and it becoming an obsessive compulsive disorder, which you don't want. So just wash your hands before you have a meal, after you go to the bathroom, all of those things that they teach us to do. And make sure that it's at least 20 seconds long. Sometimes I send my child back and say, go back. That was only like 5 seconds. Wash your hands for longer. So that's that. And then touch your face a lot like me. I've done touch my face a bit. Try and wash your hands regularly. So the next question, I put it on my story. So if you want to see the questions, I try and put that on the Vine Health story. So the next question is, my mom has had this hand sanitizer that was given to her by a friend abroad last year, but mistakenly she broke the cover and it has been open since then. Is it still good? No, it's not good anymore. If the cover is broken and it's open, then obviously alcohol evaporates. It loses its potency. It's not good enough. I mean, I have quite a high grade sanitizer, which obviously I have at work, which I can show you. But I tend to avoid sanitizers unless I don't have access to soap and water. Soap and water is a whole lot more effective. Wash your hands, put some hand cream on because you want your skin to be nice and smooth, and just move on from there. And the same person, I think the same person must have asked the next question, which was hand sanitizer expired in February of this year. Is this still okay to use? If it's expired, I cannot sanction using it. Obviously, some people say that most products are effective for 3 months afterwards, but I cannot, as a medical professional, say that you should carry on using hand sanitizer that has expired in February. So I would say no, try and get another one, or just stick with soap and water. Hand sanitizers are scarce nowadays, and you don't really need it unless you are somewhere where you don't have access to soap and water. The only time I also use antibacterial, antiseptic wipes is to wipe down my desk or surfaces at work where people are touched, on phones, and if you have a mobile phone, just try and wipe it down as well, and that will be it. I think that would be enough for today because of time. I talked about resilience. The reason why I titled this resilience is that I've had a lot of phone calls. As you know, most doctors and nurses and people are now doing telephone triages where I'm hardly bringing anybody in. But so the phone calls I've had are about people saying that they don't want to go to work, the key workers, because they're really scared of contacting this virus and bringing it back home and infecting their families. To the point where people are getting extremely stressed and they're crying. Somebody wanted a sick note yesterday because they didn't want to go to work because they are really scared. So is that resilience? How do we build our resilience in the face of difficulty? Everybody gets scared. I get scared too. I don't want to go and see a patient who has coronavirus and then get infected. Everybody gets scared, but it's just being able to look at the facts and assess your risk. So if you are working in a place where there's risk, the first thing to do is to talk to your employers, because they have an obligation to keep you safe. To talk to your employers, see what safety measures have been put in place for you. Obviously, if you're not supposed to be there, don't be there, because again, I've seen some rascal employers who are not key workers, but they are making their employees come in. That is breaking the rules. You're not supposed to be there. So don't put people at risk because you're trying to keep your business afloat. We know that everybody is stressed right now, but people should be at home. So have a word with your employer first. Explain to them your fear and your concern. Let them tell you what they're doing to protect you, and then make an honest assessment of that. And obviously, when you come back home, wash your hands, have a shower if that makes you feel better. But understand that you're not posing at any extra risk. So that resilience, we need it now, and this is day 18 of this live update. I think I started it like a week before the lockdown. So, we are in for the long haul now. I'm trying to be resilient as well, to keep going and just to keep strong with this. You just need to also try your best today to watch out for your mental health, watch out for your mental state. The loneliness, if you're living alone, is real. So this is where resilience needs to come in. Even when you're living with people, the interruptions, people that you've not lived with for that long, for that sort of constant being around each other, can also, test your resilience. So put some comments in the box. Let me know how you're coping at this time. Send some questions. I mean, I was going to make tomorrow like Money Friday, wealth and wellness, but that would only happen if I have some money related questions so that I can ask an expert. I don't want them to waste their time coming on and having no questions to answer. So if you have any money related questions, send it to the WhatsApp number that I posted a few days ago. I'll try and post that in the comment box as well. Send it to the WhatsApp number, send it into a direct message to Vine Health. Just send your questions about money, and then I can try and see if I can get an expert to come and talk about money. Health is wealth. Wealth is health. So have a great day, everyone, and I'll be back tomorrow, Friday, for our next update.